Welcome, everyone. I just wanted to let you know that we're going to wait as we have some more people entering the room, and we will be getting started in just a couple minutes. For those of you joining the room right now, I just wanted to let you know that we will get started in just a couple minutes, and welcome. Thank you for joining us tonight. Okay, so we will get started. Good evening, and thank you all of you for joining us this evening. Welcome to UB's academic signature presentation with the School of Pharmacy and Pharmaceutical Sciences. My name is Kira Love. I'm the Director of Transfer Experience and Summer Winter Sessions in the Office of Admissions. And again, I want to thank you for joining us and taking the time to learn more about our School of Pharmacy and Pharmaceutical Sciences. During today's presentation, you will be hearing from faculty and staff within the School of Pharmacy and Pharmaceutical Sciences. And this is your chance to learn important information regarding majors, requirements for programs, the types of classes students take, and all the additional opportunities students have both within as well as outside of the classroom. Throughout the presentation, we will be monitoring the chat section of this session. So we encourage you to submit any questions that you have there. I and Jessica Clark, who's also joining us from the Office of Admissions, will be answering any general admissions questions that you have. And the School of Pharmacy and Pharmaceutical Sciences will be answering any specific questions pertaining to their programs. Now I'm going to turn it over to Sarah Robinson, our Associate Director of Admissions and Advisement for the School of Pharmacy and Pharmaceutical Sciences, for the introduction of the presenters who are leaders in their field and dedicated to our students. I'm sure you're going to find what they have to say very interesting. Welcome, Sarah.
Thank you, Kira. I'm really excited to be here tonight. I have this wonderful view right in front of me of the fall foliage changing outside my window. So I'm feeling very excited to be meeting with you and sharing with you information about our school and programs. So right now, I will start by sharing with you our first slide. I wanted to get an opportunity to introduce you to the people who will be with you tonight from the School of Pharmacy and Pharmaceutical Sciences. Behind the scenes will be Jennifer Rosenberg, our Associate Dean for Admissions and Enrollment and Pre-Pharmacy Advising. And to start us off is going to be Dean O'Donnell, who is the 11th Dean of the UB School of Pharmacy and Pharmaceutical Sciences, who joined us in 2013. His research is focused on the relationship between the neurochemical and behavioral effects of drugs, primarily those used to treat neuropsychiatric illnesses. And he's been active in teaching professional and graduate students in the areas of pharmacology and neuroscience. He's also been elected fellow of both the American College of Neuropsychopharmacology and the American Association for the Advancement of Science. So Dean O'Donnell, I will turn it over to you.
Hello, welcome. It's good of you to join us today and learn a little bit about the university and the school. First, I just wanted to talk about the university in general. The University of Buffalo is the flagship public university in the state of New York. What this means really is that we offer the greatest opportunities in terms of research, the range of educational programs, and opportunities for being engaged in many types of community and outreach activities. We have an amazing faculty, an amazing student body, and there really is no limit in terms of what you can get involved in and what you can experience at the university level. Our school, which is the School of Pharmacy and Pharmaceutical Sciences, if I could have the next slide, is the #1 school of pharmacy in the state of New York, and the number 14 ranked school in the United States. 14 doesn't sound as good until you realize that there are 146 schools of pharmacy in the United States total. So we really are in the top 10%. And the reason we're there is because we have a long tradition of educating pharmacists and pharmaceutical scientists that goes back to 1886. We can actually trace our history back even further than that to 1846, when we were a department in the medical school, the first school at the University of Buffalo. I did mention we have outstanding research. Our faculty are involved in basic science research in a variety of areas that are related to drug discovery, optimizing pharmaceutical treatments, treatment of disease, understanding pathophysiology of disease. And this really does range from the most basic wet lab research to studies in humans looking at how they respond to treatments. Our pharmaceutical sciences faculty really have developed some of the basic principles of PK/PD modeling, protein therapeutics, and drug delivery. And our pharmacy practice faculty are working pharmacists in practice settings, working with patients every day. So what you learn at the basic science level and what you learn at the clinical level is taught by people who are living the life, who are doing that day in, day out. One advantage we have being a public institution is that we are more affordable than many schools of pharmacy and pharmaceutical sciences. We also offer financial aid in a number in both need-based and merit-based that's available both to incoming students and to continuing students. And you'll hear something about the size of the university. It's 30,000 students. Don't even remember how many faculty and staff. But we are a large comprehensive university. But the School of Pharmacy and Pharmaceutical Sciences itself is a relatively small community. Most of us are in one building, so you really do get to know the faculty and staff. You get to know the other students. And the building was designed just for us, so it really does have state-of-the-art educational research and training spaces that are available to the students. And for those of you who are not from Buffalo, I'm not a Buffalo native. It's a great city. It's a lot to do, great weather in the summer, a little cold in the winter, but not so bad. Very affordable, so it really is, you can live well in Buffalo and enjoy all the amenities of a great city. If I could have the next slide. And this is really the final point I want to make, and it really is very, very important, particularly for those of you who are interested in pharmacy rather than pharmaceutical sciences. So it does have some relevance to pharmaceutical sciences. And that is, we are part of an academic health center. And that simply means that in addition to a school of pharmacy and pharmaceutical sciences, we also have a school of medicine and biomedical sciences, school of public health and health professions, school of nursing, school of dentistry, school of social work. That means that you'll have the opportunity to interact with health science professionals and educators from a variety of different disciplines. You'll meet students from these different professions. And so you'll learn during your coursework, but also during your experiential years when you're in the clinic practicing pharmacy. You'll learn to work alongside of other health science professionals. And the reason why that's important is that really is how health sciences work. It's a very team-based approach. And pharmacists are central to this in terms of managing medications. Having a health science center really is a unique opportunity. The other component of the health science center, in addition to our schools, are our partner hospitals. We partner with Erie County Medical Center, a public institution, as well as the Kaleida Hospital System, a private institution. And these form the core of our health science center. But in addition to this, we work with Roswell Park Cancer Institute, the Catholic Hospital System, the Veterans Administration Medical Center. So there are tremendous opportunities to interact with pharmacists and other health professionals in these settings. And as it mentions in the slide, there are only 40 academic health centers that have schools of pharmacy. So when you combine, our expertise and our longevity in terms of training students and contributing to the science of pharmacy and pharmaceutical science, it really does put us in a fairly unique group. So I hope you take this opportunity to learn what you can about us and enjoy the presentations. Thank you.
Thank you, Dean O'Donnell. So let me start by taking us back to the basics here, where I can talk to you a little bit about what makes up a good pharmacist. So some of the resources that we pull from in this presentation come from a website called pharmacyforme.org, which is put together by the professional organization, the Association of American Colleges of Pharmacy, AACP. And so they put together this list of characteristics and skills that make for a good pharmacist. So in looking over this list, think about if this is characteristics or skills that you have or things that you are really willing to take on as part of your studies. And this will be a good kind of guiding list to work from as you consider this career path. Pharmacists are good problem solvers. They are good communicators. And those are some key elements of being a good pharmacist beyond being proficient in math and science fields of study. Pharmacists are provide healthcare, and they help sick people through direct patient contact. And so some of the ways that pharmacists can help sick people are through dispensing medications and filling prescriptions, making sure that medications are not going to be a problem with other medications that you may be taking. So those drug interactions are a key checkpoint for pharmacists. They will also work with other healthcare providers, insurance companies, and direct counseling of patients. Now, our pharmaceutical scientists are also helping sick people, but they do so from the research lab. So pharmaceutical scientists will be working directly with the drugs that patients may be taking, but they don't have that patient care piece. So that is a real key difference between whether you might be considering becoming a pharmacist or whether you might be considering pharmaceutical sciences. If you have that interest in patient care, pharmacy may be right for you. But if you're really interested in the drugs themselves, and how to make them better and improve patient outcomes, but without that patient interaction piece, then maybe pharmaceutical sciences would be a good fit. Pharmacists work in lots of different areas. So a lot of times students come to us and think, well, it's community and it's hospital and that's pretty much it. And that's not always true. A lot of our pharmacy graduates go on to a variety of different fields, and some of them are on the screen in front of you. So community is one aspect, clinical pharmacy and hospital settings is another aspect, but you could also be a pharmacist working in managed care, which would be like an insurance company situation. You might work for a government agency. You might work for the military. You might be a veterinary pharmacist. So there's a lot of different ways that you can specialize where your career will take you. This just gives you an overview of where our recent graduates have gone. So what we do is we survey our graduates the year following their graduation, and we ask them where they're working. So in the first year following their graduation from the PharmD, we found that our students mostly will start out in community pharmacy. That's kind of the biggest portion of the pie. But we're seeing a growing number of our students who are starting out in residency settings. So residencies are optional postgraduate years of training. Students can do 1 year of residency or they can do 2 years of residency. And basically in a 1-year residency, students are getting 1 full year of additional clinical training. So they are in typically hospital environments, though not always. There are community residencies as well. But it's a full-time year just in the field, and it's a way to build one's resume a little bit more deeply. A second year of residency will often be specialized in one specific area. So it might be a specific patient population, and therefore the medications that are most relevant to that patient population. So for example, a second year residency could be in psychiatric pharmacy, it could be in pediatric pharmacy, oncology, you get the idea. So we're seeing that those are kind of 2 of the bigger areas that our graduates will go on to within their first year following graduation. This gives you some of the degree programs that we offer within the School of Pharmacy and Pharmaceutical Sciences, as well as in collaboration with other schools at UB. So if you're interested in pharmacy, our PharmD program is a 2+4 program for students who are entering UB without any prior college. So that's for high school students coming to UB right away after high school, starting in the pharmacy program. So that will be 6 years, and students will earn their Doctor of Pharmacy or PharmD degree at the end of those 6 years. We also offer a number of dual or collaborative degrees. So this is where students can get not only their PharmD, but also another graduate degree along with it. The PharmD master's degrees that we offer with business administration, public health, and pharmaceutical sciences will add 1 additional year of study. So it's 2 years of undergraduate, 4 years of pharmacy, and the 1 year of the master's. And students do take 1 full year break from their PharmD studies to complete that master's. We also offer 2 PharmD doctoral degrees, 1 with pharmaceutical sciences, a PhD, and then 1 with the School of Law. So if you are interested in being in school for a little bit longer and really specializing your degree path, you can do that here. And then we offer 4 different combined PharmD degrees. So a combined degree is a bachelor's degree, an undergraduate degree, and the Doctor of Pharmacy degree. These are also 7-year programs, but students will do 3 years in undergraduate and then 4 years in the PharmD. And the idea here is that some students want to be an undergraduate for a little bit longer, and there could be all sorts of different reasons for that. As a Division I school, students might be interested in competing at the Division I level, and so they would want that extra year of eligibility at the undergraduate level because it provides a little bit more flexibility. Or we've seen students who maybe started in biology, not really sure what they wanted to do, and then decided later they wanted to pursue pharmacy. So this gives a direct pathway into our pharmacy program while still using all of those biology credits that have already been started to finish that biology degree. In regards to the pharmaceutical sciences, this is a very traditional 4-year Bachelor of Science degree. It's very much like you would see a biology degree or an art degree or a sociology degree. We do offer a combined BS-MS with pharmaceutical sciences as well. So students are interested in completing their master's degree. And this is specifically helpful if you want to work in industry and you don't necessarily want to start at the entry level. You want to kind of get into the research lab a little bit faster. Completing the master's degree is really going to be a good option for you. And you can finish your master's in a shortened period of time. So the BS-MS is a 5-year program. We also offer 2 different masters in pharmaceutical sciences. Our pharmaceutical sciences masters, which has long been a part of our program, and a newer master's in pharmacometrics and personalized pharmacotherapy. And then we also have a fully funded PhD in pharmaceutical sciences. So just to give you an idea, Dean O'Donnell spoke about the size of our school. This just gives you an estimate of how many degrees we confer each year. and shows you really our school is rather small within the context of the large research university that is UB. You can also see that of our combined degrees, we awarded the most to our PharmD MBA. That is by far our most popular dual degree. Our School of Management is another really top-notch program at UB, and we have a lot of students that really want that business background before they go and run their own pharmacy or maybe own their own pharmacy someday. And a little bit more about graduation. Our alumni are very involved with our school, and we're really proud to talk about them, especially in recruitment. We have a very active group of alumni who not only stay involved with our school and help us with like admissions reviews and interviews, they also help us fund scholarships that we can offer to our students, and they serve as career mentors to our PharmD candidates. So if you have an interest in a very specific area of pharmacy, or maybe a specific geographic area of the country that you want to end up in, we can, by and large, pair you with an alumni mentor who can really give you the guidance about what it takes to go down the path that you're thinking of, because they've done it themselves. So this is a really unique opportunity that we have to offer our students. Our tagline is graduating pharmacy leaders, and we really do mean that. We are the second most productive school of pharmacy in placing our graduates in leadership positions in other schools of pharmacy nationwide. So you'll see a lot of department chairs and deans at other schools of pharmacy are UB graduates. So just some other areas where our graduates work, just to give you a sense of some of the places that you can go with this degree. You'll see it's a mix of pharmaceutical companies, different pharmacy brands, but a lot of different ways that you can take this degree and move your career forward. Now, when you come to UB as an undergraduate, we do provide a great deal of support to our undergraduates because we really want to help you be successful in this program. So that's what I do. I'm the academic advisor for undergraduate pharmacy and pharmaceutical sciences students. And we provide mandatory advisement in the first semester. So I'm in the thick of that right now, making sure that no student can avoid me. And so we can make sure that students know exactly what courses they need to take, how to stay on track with their degree, how to register for their courses. We do provide a living learning community, which is active this fall even. So we have students who can live with other pharmacy students, and we do different programming and events specific for students in that residence hall. We also offer an advising portal through UB Learns, which is a Blackboard platform, so that I can provide up-to-date information with students about everything they need to be successful in their academics. We also offer 2 electives to our undergraduates, a first semester 101 course, and then a second year 201 course. And these are really designed to give students some interaction with our PharmD students who serve as mentors in the course, as well as our faculty who provide guest presentations and just give students a little bit of an inkling of what's to come. So some of the things that we did this fall in 101 is we started working on a continuous professional development plan. That's something that students do in pharmacy school. We really started talking about what that would look like as an undergrad and get students really thinking about that. We talk about different career paths that students can take, in addition to things like, you know, what grades and things you need to stay on track with your academic program. We also have student peer mentors outside of the 101 class. So these are PharmD students who have office hours, they're available by email, and they're just there as a resource to you. So as you have questions about how to stay on track, which professors to take, how did you do in organic chemistry, what should I be doing? You have other students to really tap into for that direct knowledge. And then finally, we do offer every fall interview preparation for students who are in our early assurance program. So we require an interview to gain access into the PharmD. That is a requirement for every single pharmacy school. It's a part of our accreditation process. And we hold our interviews in the first year of study because we really want students to go into that interview fully prepared. So we want to prepare you for that interview. We want you to know what to expect. And the great part about having career services help is they're the interview experts, but they're also experts on our interviews. They know the questions we ask, they know how we evaluate candidates. They have assisted us with interviews in the past, so they have that firsthand knowledge. And it's really beneficial for students to get that before they sit in an interview with a faculty member talking about why they want to be a pharmacist. So this is just some information about the early assurance program specifically. So this is for students who come to UB directly from high school without going to college in between. It is a 2+4 program. So you would do 2 years of undergraduate prerequisites and 4 years in the Doctor of Pharmacy. In those 2 years, you will take all the courses you need, and you will meet the grade and GPA thresholds that you need to meet, and you will pass an interview to maintain your seat in early assurance. To get into this program, all you need to do is apply to UB and list pharmacy as your major. The Undergraduate Admissions Office, who Kira is a part of, they are the ones that review the applications for admission. So we don't set any minimum high school average. We don't set standardized test requirements. We don't do any of that. We trust the Undergraduate Admissions Office. They're the experts. If they admit you to UB, then you are automatically enrolled into early assurance. It provides direct entry to our PharmD. Okay, so there's no additional requirements you need to meet as a pharmacy candidate. What we do is we look at your college work specifically. So we want to see that your college courses are grades of C and higher, and that you maintain a 3.3 GPA, which is like a B+ average in your math and science courses. We don't require a standardized test, the PCAT, for pharmacy promotion into the professional curriculum in year 3. We don't need a PCAT. We don't require students gather faculty letters of reference. There's no personal statement. If you meet the grade and GPA requirements, you pass that interview in your first year, then you start in the doctoral degree in year 3. So for students who are thinking of transferring to UB, students who maybe don't want to start at UB this fall, maybe they want to start at another school closer to home, we do provide entry to our PharmD degree through PharmCAS. So PharmCAS is like a common application for pharmacy schools. It's a centralized application service. You can apply to UB and many other schools of pharmacy using this application service. In order to be a candidate through the PharmCAS process, students have a minimum grade of C- in any of the prerequisites, and we look at a B average or a 3.0 GPA across math and science courses. So the requirements are not quite as high as early assurance because we do look at a variety of other factors in a more holistic way. And those other factors would include typically a PCAT, letters of reference, a personal statement, as well as experience in the field. Now, if students do meet early assurance type requirements, specifically if students have a 3.3 GPA in math and science courses, we will waive the PCAT. Students who are academically very strong and very competitive, we have found that the PCAT doesn't give us more information than we already have. So those students can waive the PCAT even if they didn't come to UB through early assurance. The other pieces of the application would still be required. So this just gives you an opportunity to see what our admissions process looked like for the class of 2023. So these were the students who started in their first professional year and graduating in 2023. So we interviewed 260 thereabouts, and we enrolled 130 students into our pharmacy program. Our pharmacy program is usually between 100 and 120. That's usually the kind of range that we look to enroll in the professional portion. We are slightly more female than male, and we are predominantly recruiting students or enrolling students from New York State. And that's because we are a state institution and we're a pretty good value for that, for in-state residents. But that's not because we have any sort of stated preference in the admissions process. We're not trying to limit our pool to just in-state students. It's just the students who tend to enroll. And we do enroll students from outside the US as well in our program. So I just wanted to share with you the list of prerequisites. This isn't anything you need to really worry about if you are, a high school student, but just so you can see the types of courses that you would take in those first 2 years. It's a mix of math and science courses and our general education program, which we call UB curriculum. Courses that you might take through UB curriculum in arts or history or social science or humanities, you might not be as strong in those courses, and that's okay because we don't include them in the GPA that we look for to maintain your seat in early assurance. But it does give you a more well-rounded, a more varied background in terms of those prerequisite courses. And then again, this isn't, not to overwhelm you with a bunch of words on the screen, but this is all pulled directly from our website. So if you really wanted to see more about the types of courses you would take as part of the PharmD program, you can look at that and you can go into our website and see the curriculum in a little bit greater detail. But just kind of a high level view, when you get into your first professional year, you will be taking foundational PharmD courses in things like calculations, pharmaceutical chemistry. I think you'll start your pathophysiology sequence, pharmaceutical care, pharmacology, a lot of pharma courses. So that's going to be that first professional year. Then when you get into your second professional year, in addition to the courses, you will start doing your rotations and you will go out in the field and you will get some hands-on experience. That's when you have secured your intern permit from New York State. And that is also when you will be doing what we call introductory pharmacy practice experiences, or IPPEs. They're also referred to as experiential education, clinical rotations. This is all the same thing, just different names for the same thing. And you'll do that in years 2 and 3. And then when you get to your fourth professional year, you are full-time in the field. And so those rotations are called advanced pharmacy practice experiences, or APPEs. And students can do those rotations in Western New York, or they could do all of their rotations outside Western New York. It really depends on what the student is interested in. This gives you a chance to see a little bit about the elective opportunities that you'll have. So through the pharmacy program, you'll take a couple elective courses, typically, and some in the second, mostly in the third year. But because we are part of that academic health center that Dean O'Donnell mentioned, we have the opportunity to offer you electives not only through the School of Pharmacy, but also through some of our academic health center partners. So students have an opportunity to take public health or nursing type courses to meet those elective requirements. Another benefit of the Academic Health Center is it provides students interprofessional education, and we can offer a credential for that as well. So students who are interested, in addition to the interprofessional education experiences that they will take part in as part of our program, they can also get that micro-credential. So micro-credentials are a university-wide offering where students will pursue some courses and some outside of classroom activities. And then as they complete the small curriculum, they will earn a digital badge that they can put on their CV. And what's wonderful about that is as they send their CV or resume out in the future, employers or people who are interested can click on that digital badge and have an opportunity to see exactly the work that they did to earn that credential. So it really, it's more than just some words on a page that say, I earned this thing. It's a way for people to see exactly how you earned it. Did you do a poster presentation? What was it on? What kind of research did you do? And so the School of Pharmacy offers a variety of ways for students to earn these micro-credentials. So they're a collection of courses. It's less than a minor, an academic minor, but it's a great way to really enhance your candidacy for future careers and just to specialize your academic program. So there's the interprofessional collaborative practice one. There's also one for pharmacy clinical research. And our scholarship, education, leadership micro-credential is our residency training program. So for students who are interested in those residencies I mentioned earlier, we don't just say good luck. We have a dedicated program for those students to follow that we found has been largely successful in students getting through the residency match process successfully. For students who are thinking about starting their education outside UB, so if you're thinking of starting at another college and then coming to our pharmacy program later, we do offer some partnerships with community colleges and with smaller liberal arts colleges across New York, also in Pennsylvania. So if you're finding that the undergraduate environment at UB is not a good fit for you, but you are very interested in our pharmacy program, you can still make that happen. You can still make that work. So if you are interested, many of the SUNY community colleges we do have partnerships with. Our early college partnerships, 3+4s, allow you to start your first 3 years elsewhere, typically biology or chemistry type program. And then after your first year at UB, you would earn your bachelor's degree at your home institution. You could go back there for commencement. You could walk across the stage with your class. So these are great opportunities for students who are considering starting somewhere else. And if you want to see, there's a very long list of partners that we do have. They, again, are listed on our website, so you can take a look at that. I'd also like to speak about our global health initiatives. This was an interest from our students. So our students had reached out and looked at different ways that they could get involved in global health, both locally and globally. So we have a student organization that focuses on this, and we also have this micro-credential. We offer in typical years when travel is allowed, opportunities for students over winter break or summer break to engage in medical mission trips. So students have gone to Honduras, to Belize, to a variety of different areas, but we also have offered those opportunities domestically as well. So through rural area medicine programs, we've had students who have set up clinics in underserved areas, whether urban or rural. And we also have opportunities right in the city of Buffalo, because Buffalo does have a large refugee population, and there are services that really cater to that population. So if this is an interest of yours, if you are thinking about ways that you could engage with global health, this could be a good home for you. Our experiential education can send students around the world, but the vast majority of those experiences are going to be here in the United States. Students can do their rotations, their experiential education, their pharmacy practice experiences, whatever you want to call it, both in the Western New York area, throughout New York State, throughout the United States. And the map kind of just gives you a sampling of those different areas where we can send students. We have a preceptor network that is over 650 pharmacists big. So that's an opportunity for students to go anywhere their interests take them. And the sites that we have, we have 1,100 preceptors at 650 sites. So this provides students great opportunities to go in so many different avenues, depending on what your interests may be. And in addition to the ways that we support undergraduates through advisement and electives and outreach, we also provide support to our professional students. So I mentioned before how we have alumni mentors. Students are also paired with faculty advisors, and faculty advisors will meet with students every semester to make sure the students are doing well in their courses, that they know exactly what's expected of them. And as they have questions or interests in different career paths or specialty areas, those faculty advisors can share with them what are the best routes, what are the best ways to develop their plan to work towards those goals. So there's a great deal of support from faculty, from alumni, and from other students. So I mentioned we have those peer mentors, but also through our Rho Chi Honor Society, students have access to tutors who are like academic consultants. So students can meet with them individually. They do different review sessions. They put together this year a P1 survival guide, which P1 is a first-year professional student. They went through each class and put together a list of tips unique to that class. For this class, you really need to pay attention to these resources. You really need to make sure you watch all the lectures multiple times, or whatever the case may be. So it was really key in providing that firsthand experience so that students know exactly what's expected of them and how to be most successful for the needs of each particular course. We also offer different networking opportunities because we have such a large alumni network, because we are so well established in the Western New York community. We have a lot of great partnerships that we can invite employers on campus and meet with students, critique their resume, provide them feedback, and all sorts of different ways to enhance our students' time while they're in our program. And some of those networking opportunities are also available through our student professional organizations. So this just gives you an idea of the vast array of ways that students can get involved in areas that might be a future career interest to them. We have a list of these, of course, on our website as well. So if you really wanted to delve into all of these different logos and learn more about what they are, but just, in looking at the screen, you can see that we have, an honor society, we have an organization specific to industry pharmacists, we have regional and national organizations, consultant pharmacists, pediatrics, you name it. I also mentioned that our alumni assist us with fundraising and scholarships, but scholarships come from a variety of different partners and funding sources. So with students who are applying to UB as new freshmen, when you go through the admissions process, there is a scholarship review process that you go through by virtue of coming here as a new first-year freshman student. You will still go through that same process as a prospective pharmacy major. So you'll be considered for any of the undergraduate admission scholarships. The university also maintains a scholarship portal for current students. So as you go through your program, you might find that there are different opportunities that you qualify for based on your background, based on your academic interests, that have been provided to the university through different alumni or other sources. We also award a Dean's Leadership Scholarship to our incoming first-year students through the Early Assurance Program. And that scholarship is awarded one time when you start your first professional year. So the idea is in that first professional year, your costs will change. We want to provide you with additional funding to help offset that change. Through the program, there are more scholarship opportunities. We award over $350,000 each year in different scholarships. So these are, again, ways to help offset additional costs that may arise. If you are interested in getting involved with one of those student organizations and you want to travel, present a poster at a conference, the different costs that come up to fund those opportunities could be funded through the different scholarships that are available. When students start in our first professional year who are not New York State residents, we work with them to establish New York State residency as well as a way to lower your tuition costs. And establishing New York State residency for out-of-state students is much easier when you start in the professional program as a graduate student. And just like Dean O'Donnell, I'm not originally from the Buffalo area. I grew up downstate New York. I came here for my undergraduate studies. I never left, and I now call Buffalo home. I think it is a great community to be a part of. We're known as the city of good neighbors. I like to believe that I am a good neighbor to my neighbors as well. It is a great place to study for, 6 years as a pharmacy student, maybe 5 years as a BS/MS student, whatever program you're interested in. The seasons here are beautiful, as I mentioned earlier, but also it is a great place to live because it's a very manageable city. I grew up not far from New York City, and that to me was, it was much bigger, and it certainly is much bigger than Buffalo. But there's really great arts whether you're interested in, art galleries or theater in normal non-COVID times. There's also different museums and, different cultural organizations if you're interested in that. There's professional sports, if that's something that you're interested in as well, a beautiful waterfront area, an extensive park system, designed by Frederick Law Olmsted, who also designed New York Central Park. I could go on and on, but I won't. Just trust me, it's a great place to visit, and I would definitely recommend, checking it out when you can. So from here, I wanted to leave you with some resources. If you are interested in learning more about pharmacy or our programs, where would you start? First, I would definitely recommend connecting with one of our students. We maintain a list of peer mentors, so they expect emails, they expect outreach. You can always request a Zoom meeting with one if you would like to talk with a student even more beyond just email. Online resources, pharmacyforme.org, I mentioned before, I would definitely check out that page. It's a great way to learn more about the different career paths and ways to pursue this program. I would also recommend, if you're interested in learning more about like what pharmacists are thinking about, what they're talking about, what's important to them, there are some free periodicals, free news resources that you can look at, specifically like Pharmacy Times. That's one that our pharmacy faculty will look at. So that's a good accessible resource for you too. If you want to gain pharmacy experience, the best way to do so is to work as a pharmacy technician. It does not require a degree. In New York State, you can work as a pharmacy technician in a community pharmacy, such as at a drugstore or grocery store. In order to work in a hospital pharmacy as a technician, you do need your certification first. Outside New York State, the certification requirements may be different. Some of the larger organizations might require you to be 18, so you can definitely look into that, but that's the best way to gain that firsthand experience. Of course, we're on social media. I'm not a big social media person, but I do like the Instagram page. So I would definitely recommend that one. There's some really great, very, very short videos on our YouTube page as well. So if you want to learn a little bit more, hear students or alumni speak about their experiences, they're very brief, so they're very digestible. I would recommend that page too. And that's my presentation. That's the information I have to share. So I will stop my share at this point and see if there are any questions that have come up that I can provide any additional information about. Oh, yes, Jennifer has responded or shared information in the chat about our Pharmacy Summer Institute. So I didn't mention that, but that is another really great way to learn more about not only our program, but the pharmacy program as a whole. We offer this institute every summer in July. This year, we put it fully online. We had students from all over the world participate, which was a really exciting experience. Maybe some of them were a little tired. It was probably happening at odd hours for them, but it was a really great way to hear from our faculty, hear about different topics that pharmacists talk about, care about, things like vaccinations, medical marijuana, the opioid epidemic. We had, different presenters come in. We also had some different activities students can engage in. So I would definitely recommend checking our website and keeping in contact with us if you're interested in participating. It is traditionally something that we invite high school students as well as college students to join us. And we've had really great feedback from students in participating in that. So in regards to some other questions, a popular question I often get that I did want to make sure I mentioned is in regards to AP or college credits, satisfying requirements, we get that one a lot. And if you are taking any AP courses as high school students, taking any AP exams, we do accept those for credit to satisfy prerequisite requirements. Those can be used to, depending on the exam that you take, they could be used to satisfy general education UB curriculum requirements, as well as math and science requirements. So as you are considering UB, if you're taking courses like AP Bio, Calculus, Stats, Chemistry, we do accept credits at a score of 4 or 5 for those. So as you have any specific or individualized questions about things like that, I would definitely encourage you to reach out to us for any advisement or any information that you might need. Question about undergraduate class sizes compared to PharmD classes. So that's a good question too. At the undergraduate level, the university is large. There are some large lecture halls when classes are in person. So there might be, for a biology or chemistry course, there might be a lecture that could be between 300 and 400 students. But both of those courses do offer what is called a recitation, which I like to refer to as a review session. So once per week, students are required to attend recitation. It is typically facilitated by a teaching assistant who's a graduate student in that subject area, and students will have an opportunity to engage in a much smaller class size. So those could be, 22, 24 seats, maybe 30 seats. And that is a little bit more interactive, and it gives students the opportunity to hear, a different point of view, a different perspective on the material, and learn from another person. But typically the lectures that are facilitated by professors are where new information gets shared. Recitations is more of a review of what happened in lecture and a way for students to ask questions. So it'll be a mix of large and small. Students also take a seminar through the UB curriculum in their first semester. That will be a small seated class as well. When you get into the PharmD program, your classes will be definitely as large as your pharmacy cohort is. So if you are a cohort of 100 students, you will have 100 students in those foundational courses as well. And then as you go through the program, you'll have a mix of large and small courses there too. A question I was asked about the dual degrees, the benefit of doing a pharmacy dual degree compared with a master's in research alone. That's a good question. It really depends on what you're thinking of doing for your career. If you are interested in drug research and you do not have an interest in patient care, it might not make sense to get the PharmD. It might make sense to pursue the master's as a standalone degree. But if you are thinking that at some point you might want to work with those patients directly, the PharmD would be very valuable in that situation. So it just really depends on what your career path will look like in terms of which degree you would want to pursue. A lot of discussion. It's hard to keep up. If you are applying and you do not have your prereqs done at the time you apply, that is okay. It's very similar to the freshman admissions process. So when you are a high school senior and you apply to college, you haven't actually graduated from high school. But as you get offers of admission, the unspoken agreement is that you will graduate high school and then your admission will be finalized. And it's the same thing with pharmacy admission. So if you are a college student somewhere else and you apply, we don't expect that all of your prerequisites are completed at the time you apply, but we do expect that they are completed with the minimum grade by the time you enroll in our pharmacy program for the fall. A question about the benefit of attending a large college setting versus a smaller college setting. That is also based on your personal preference. So some students really prefer being in small classes where they can have more conversation style education, whereas some students really prefer sitting in a larger room and taking their notes and listening to their information. As a undergraduate student, I was looking for a place where I would not be in small classroom settings, because the idea of being called on and not knowing the answer induced a lot of anxiety in my youth. That still does. So it really depends. I mean, one of the advantages of coming to a larger school like UB is all the really great resources that a research public university has. And smaller schools might have different offerings. They might have similar things, but maybe not as much variety. You might find that the student population is slightly different. So you really want to, look at the different schools that you're interested in and make a decision based on what factors you think are going to be important to you. Because ultimately, if you want to be successful in pharmacy school, you need to first be successful as an undergraduate, and you need to find that place that is going to provide the avenues for you to be successful. And sometimes that's going to be UB, and sometimes it's not. And of course, we want you to come to UB, and we want you to go through the early assurance, and we want you to have that direct entry option. But if you're finding that another environment for you to start is a better fit, you should definitely take a look at that as well. A question about the 2+4 program admission. Do incoming freshmen start their program right away in the first term? So in regards to the early assurance program, students will apply through the common application, the SUNY application, the coalition application. Doesn't matter, choose an application, whichever one you want to complete. They're all reviewed the same. You'll indicate pharmacy as your major. Then your application will go through the undergraduate admissions office. They are familiar with the high school you attend. They are familiar with the way your school grades. They know the types of offerings you have, and they're just generally the experts on college admission. So they are the ones that are going to review your candidacy for study at UB. Once they have admitted you, then we will enroll you directly into our early assurance program. So there's nothing additional that you would have to do to state your interest in early assurance. You would do 2 years of our prerequisites. You will have to meet minimum grade and GPA requirements to maintain your seat. And you will also complete an interview as part of the first 2 years to maintain your seat. And then as soon as those 2 years are done and you've met all those requirements, you will start in your 3rd year in the PharmD program, and you will do 4 years of the professional curriculum. At the end of those 6 years, you will be awarded your Doctor of Pharmacy or PharmD degree. So hopefully that answered the question that I saw up there. Is honors an option with early assurance? Absolutely. One of the nice things about the university's honors college is that it matches really well with pharmacy. So as part of the honors college, students will need to complete a seminar course, which is an honors seminar, but UB students have to take a seminar anyway. So you just have a list of honor seminars to choose from in your first semester. And then students will complete the honors colloquium in the spring of their first year, which is a 1 or 2 credit course. It fits nicely into your prerequisites. It's not difficult to make happen. And then for the rest of the program, you need to complete certain honors experiences. And those could be graduate courses, they could be internship credits. And that's the type of stuff you're going to be doing in your 3rd and 4th years as part of the pharmacy program. So you actually don't have to do anything special or different than just persist in the PharmD. And you will be successful in staying on track with the honors requirements. There are a lot of questions, so I hope I'm getting to enough of them. It looks like Jennifer has been feverishly keeping up. So I think those are it. At this point, I just want to say thank you to everybody who came and visited and met with us today. If you found that your question was not answered, I will just really quickly share my screen one last time. You can email me at prepharm@buffalo.edu, If you have any questions after the session today that you didn't get answered, you would like more clarification on, anything at all, I would also really encourage you to check out our website. I know I mentioned it a bunch of times. I'm sorry for sounding like a broken record, but there's a lot of really great detailed information that's outlined there. So if you Google UB Pharmacy early college pathways, if you Google UB Pharmacy dual degrees, you'll be able to find a lot of great additional detail there. So thank you all for coming, and thank you for spending some time with us tonight.